science community, and welcome back to another week of This Week in Biomedical Careers, where we talk about and learn about various careers that you may want to explore in hopes of helping you decide what you want to do with your lives. Last week, we talked about a career in biomedical engineering, and this week we're transitioning over to the treatment side of things, where we'll learn about the respiratory therapist. Today we have a great show for you with lots of information as always, and an interview with an actual respiratory therapist to get you the insights into the job. Without further ado, here is a career as a respiratory therapist. This week's biomedical career choice is the respiratory therapist and offers a clear insight into the mind and life of one. Respiratory therapists treat a range of patients with breathing problems such as asthma or emphysema. They provide direct care, patient education, or care coordination, and are trained in respiratory care and medicine. Everyone needs to breathe to stay alive, and respiratory therapists care for those who have a little more trouble doing so than others. As of 2016, the median pay for a respiratory therapist is about $58,670, but depending on one's certification, their salary can differ. The lowest level of certification, a CRT, can earn as low as $42,490, whereas the highest level of certification, a RRT, can earn as high as $81,550. So, today in order to learn more about the life and career of a respiratory therapist, we have Dylan Shee joining us here to give us an insight into his life and answer some questions to help us better understand his career. He's calling in from Washington, and we are so excited to talk with him. Hey Dylan, how's it going?
Good, how about you?
I'm doing great, thanks for asking. We are so excited to have you on the show with us today.
Thanks, it's great to be here, and I hope to teach you guys something because I know not many people know a lot about what I do.
Well, that's what we're here to fix, so let's get into the questions, shall we? So, let's start simple. What is it like being a respiratory therapist?
It's good, and I really enjoy doing it. I can have an impact and help anyone. I treat anyone from an infant child with undeveloped lungs or elders who have some sort of lung disease. There really is no limit to who I can help, and it feels good to know that I could have an impact on anyone's life. I've kind of known that I've wanted to do this for a while.
So then what made you want to become a respiratory therapist?
That's a good question, since respiratory therapists aren't usually one of those common jobs you hear all the children saying they want to be when they grow up. I actually had not even heard of a respiratory therapist until I was in high school. My younger sister actually had asthma, and we had to take her to a respiratory therapist to be treated. That was actually the first time I heard of one, but once I got to college, I realized my love for helping people in biology and felt like a respiratory therapist was a good fit for me, considering how much one had helped my family.
So then, what type of education or training did you have to go through to get to where you currently are?
I personally am a certified respiratory therapist, or CRT for short, and have an associate and bachelor's degree. Before I became a fully certified respiratory therapist, I did a lot of shadowing in clinic where I followed around others and gained pointers from them to get used to the hospital setting. I also had the opportunity to treat patients myself with a supervisor watching to get the experience without as much pressure.
In addition to a certified respiratory therapist, or CRT, one can also be a registered respiratory therapist, or RRT. A CRT is the first level of certification, and one must have an associate's degree and pass an exam. Then, the RRT is the second level of certification, and one must have already been a CRT, meet educational requirements, and then pass another exam. But before one can go for these certifications, they must earn at least an associate's degree, but most employers prefer those who also have a bachelor's degree. In addition, a respiratory therapist must also be certified in every state they practice in, except for Alaska. They usually take courses in human anatomy and physiology, chemistry, physics, microbiology, pharmacology, and math, which prove to help them in their careers. So then, what type of responsibilities do you hold as a respiratory therapist?
One of the main jobs I do is test patients in a variety of ways to diagnose them with what is wrong with their lungs. These tests I perform can then help me to diagnose them and determine the type of treatment to use in order to best help them. Some of these tests I utilize include measuring lung capacity and taking blood samples.
Respiratory therapists perform various lung function tests in order to test how well your lungs are working, detect any problems with the lungs, or see how well treatment for lung disease is working. These tests can measure how much air your lungs can hold, how quickly air can flow in and out of your lungs, and how well your lungs take in oxygen and give out carbon dioxide. One of the main tests is spirometry, involving the use of a spirometer, which the patient breathes into. This test specifically deals with the movement of air through your lungs and can tell you how much air you exhale, how much air you can inhale or exhale in 1 minute, and how much air is left in your lungs after a normal exhale.
Another important job I do includes helping or treating patients who have these breathing problems and try to help them as best as I can. Some treatments I can perform on patients include short-term ones such as a chest physiotherapy or long-term ones such as hooking them up to a ventilator. Although both very different, they both help the patients immensely.
A chest physiotherapy, although sounding complex, is actually quite simple. All it involves is the respiratory therapist vibrating the patient's rib cage by tapping their chest and encouraging them to cough. This motion helps to remove mucus from the lungs, making it easier to breathe. This is necessary for those with lung disease and is especially helpful to those with cystic fibrosis. Another form of treatment mentioned was connecting patients to their own ventilator, delivering oxygen to their lungs if they cannot breathe. A tube, which is connected to the machine, is inserted down one's trachea and must be constantly monitored by the respiratory therapist to ensure it's working properly and correct levels of oxygen are being given.
I also make constant rounds around the hospital, stopping by to see my patients and ensure they have all the things they need. While there, I work closely with registered nurses, physicians, surgeons, and medical assistants. Since the hospital is open full-time, I work many hours, sometimes even into the night. It is my job to ensure all my patients are taken care of. Although most of my time is spent in the hospital, I can make emergency trips to one's home if I am needed.
Since breathing is such an important part of life, respiratory therapists are usually one of the first to see a patient when there is an emergency. Before other treatments can be made, they need to ensure that the patient is receiving the right amount of oxygen or breathing properly. Sometimes they even have to ride in ambulances or helicopters with registered nurses when going to transport patients to the hospital. They always have to be prepared to respond to emergency calls on sudden cardiac arrests or urgent care.
Lastly, an important part of my job is educating people, whether it be patients or their families. I need to inform them about treatments or the best ways to exercise to stay healthy and not have any more problems. I can treat them, but that doesn't guarantee it won't happen again. It is important for my patients to know how to take care of themselves to stay healthy.
That's great! Well, that's all we have time for today, and thanks so much for taking the time to join us here today. You've really helped us to learn more about what you do, and hopefully more of our audience are considering a career in respiratory therapy.
Thanks so much for having me. Bye.
Well, there you have it, folks. What a day in the life of a respiratory therapist is like. I hope you learned a lot about what they do, because I know I did. I know I'm considering a career in respiratory therapy because I really enjoy helping people, and I know that's a main part of the job. Also, I feel like this job would allow me to learn more about the human body and specifically the respiratory system, something I've always been interested in. Learning about the treatments and technology used to help people, such as ventilators and spirometers, was really cool, and I hope to work with one someday. I'd like to give a special thanks to Colin for helping me to produce the show, and thanks to all my viewers for tuning in. See you next time!